Okay, thanks Michael, and good morning from New Zealand. What I'm going to do now is give you a brief overview of the front of pack labelling system that's been implemented in Australia and New Zealand, which is called the Health Star Rating System. As a little bit of background and context to that system, I can tell you that we have had mandatory back of pack nutrition information panels on most packaged foods in both countries since 2002. Around about 8 years ago or so, there was an independent review of food labelling law and policy that looked at all aspects of food labelling and made many recommendations, one of which was recommendation 50, that an interpretive front of pack labelling system be developed for Australia and New Zealand that is reflective of agreed public health priorities. And the idea was that the mandatory back of pack nutrition information panel remains on packages, but it's supplemented by an interpretive front of pack system. So following that and various processes that were put in place in both countries in terms of designing and developing a suitable system, the Health Star rating was adopted in 2014. It is a voluntary interpretive front of pack labelling system that rates foods from half a star to 5 stars, with 5 stars being most healthy. And I'll show you some examples of what the label looks like on the next slide. The scoring algorithm is based on the UK Food Standards Agency algorithm. It's very similar to the Nutri-Score algorithm also that Chantal has just outlined. It takes into account the same positive and negative food components that you can see listed there, but it has been slightly modified from the UK system and is a little bit more complex than Nutri-Score as well. There are a range of formats that manufacturers can put on their products. You can see 5 of them outlined on the slide here. They range from the most detailed, which is number 1 there, which has the Health Star rating and energy icon, the 3 specific prescribed nutrient icons, and then there's 1 optional nutrient icon that can be for a positive nutrient like fibre, for example. The second version there is very similar but without the positive nutrient, and then they become progressively simpler as you move down. It is the responsibility of manufacturers or companies to determine which format to put on their products based on pack size and label size. But the first 2 versions that you can see there are the ones that are particularly recommended. There has been a review of the system in place since it was adopted in 2014, with some interim results reported in 2016 and some more recent results emerging now in 2018. The first part of the review has looked at what the uptake of the system is, because of course it's voluntary. And you can see outlined in the table here that uptake has increased progressively over the past 4 years in both countries. New Zealand did adopt the Health Star rating a little bit later than Australia, probably about a year later when they really formally adopted it. So you can see from the numbers that uptake in New Zealand is probably about a year behind Australia. But the most recent data from Australia suggests that it's on about a quarter of products there. And it's on about a fifth of products now in New Zealand. One of the things we are interested in is what format of the HSR is being adopted. And you can see that around about 10% of the HSR labels in Australia are an energy icon only. So that's the non-interpretive little thumbnail that just gives information on energy. And in New Zealand, that's around about 15%. And our work indicates that particular format's been adopted mainly on non-alcoholic beverages and confectionery. Some other work that has been done as well has examined the distribution of star ratings on products. Again, bearing in mind that this is a voluntary system, really trying to identify whether the system is being used selectively or whether it's being rolled out across all product ranges. The data from New Zealand in 2018 shows a significant right skew to the distribution. So it shows very clearly that the label is being used predominantly on products that are 3.5 stars or higher, rather than on those that would display lower star ratings. The graph on the right is data from Australia in 2017, and what that's showing is that of the potential star ratings that products could display, what proportion of those products are actually choosing to display the star rating. And you can see that the proportion is again higher for those products that are eligible to display high star ratings. And work from that study, which was carried out by Ali Jones at the George Institute, also compared the average health star rating of manufacturers in terms of what they displayed and what their full product portfolios show, and found that only 3 of 26 major manufacturers had average health star ratings on products that actually reflected their full product range. I think there's been some mention about potential impact on reformulation. There's certainly been work that indicates that systems like the Choices logo and the Heart Foundation TIP program have promoted reformulation of products. However, most of the studies that have been published are pretty basic before and after evaluations, many of which are also self-reported data, and they don't take account of the wider changes to the food supply because, of course, food products are constantly being renovated and reformulated across the whole food supply. A very basic reformulation analysis from New Zealand did indicate that perhaps HSR was driving reformulation, but more recent rigorous analysis where we've also been able to take into account what reformulation is occurring in unlabeled products found minimal evidence of HSR-driven reformulation. So some indication that there is some happening in terms of sodium, but a very minimal amount. And this suggests that perhaps the voluntary nature of the health star rating system and the selective application that we're seeing might mean that reformulation is not as much of a manufacturer priority as it would be for mandatory systems. Impact on consumer behaviour. We have done some research to compare the health star rating system with traffic light labels using the Nutrition Information Panel, which is non-interpretative, as a control group. So what this forest plot here is showing, if you look at the bottom part of it, where it shows all participants, it's showing what impact traffic light labels have versus the Nutrition Information Panel, and the health star rating versus Nutrition Information Panel. What we found in that study was that overall there was no significant impact of either system on healthier food purchases. However, a sub-study that focused on frequent label users did indicate that both health star rating and traffic light labels promoted healthier food purchases compared to the non-interpretive label. And that's really pretty consistent with what we know about labelling, which is that across the whole population, it's only a subset of people that tend to use labels and use them frequently. But what this suggests is that for that subgroup in the population, that interpretive labels like health star rating and traffic lights do promote healthier food purchases. So what are the strengths of the health star rating? I think a major strength is that it's a really simple format, and it's very well understood by consumers, including those with low health literacy. It also rates the overall nutritional profile of food, so it's like a summary indicator system, as Mike pointed out. And that makes it much easier for consumers and shoppers to basically understand the system. As I mentioned earlier, it is based on rigorous systems in the UK and that have previously been adopted by Food Standards Australia and New Zealand to identify which foods are eligible to carry health claims. And of course, like any front-of-pack labelling system, it can be used to support and strengthen other policies. Weaknesses of the system, I think our evaluations to date do indicate that because it's voluntary, it's being used selectively by industry, and that I think means that customers and shoppers are not getting the full benefit of the system. I think the non-interpretive energy icon is a problem, particularly because it's being used predominantly on less healthy products. It's a particular problem for beverages because it means that the beverages that use the energy icon can't be readily compared with beverages that use the full health star rating. There is a lot of discussion in both countries about alignment of health star rating with dietary guidelines, and there are some perceptions that it's not well aligned with our dietary guidelines because some products get high star ratings despite being non-core foods. The issue with this, of course, is that it reduces consumer and public health trust in the system. There's also, it's quite a complex algorithm. Chantal outlined really well what the Nutri-Score algorithm is like. The health star rating is more complex again. I think the main issue with that is not that the algorithm is complex, but that it kind of feeds speculation that it's being somehow manipulated by industry, and that, of course, is not a good thing in terms of trust in the system. And I think finally, an issue was that there were no performance measures agreed at the time of implementation, and now we're at the point of evaluating the system. It means that it's very hard to define success or failure because we didn't have predefined targets in terms of uptake and use of the system and distribution across products and so on. So for countries that are considering implementing a front-of-pack labelling system, I would definitely urge you to put some performance measures in place before it is implemented. That said, I think a really positive thing about the health star rating is that it was implemented with a review plan in place. The results of the 5-year review will be available in 2019, and the review is very comprehensive and looks at a whole range of aspects that you can see outlined here. So that, of course, gives us the opportunity to identify where the system's performing well, but also where it's performing less well, and make improvements to the system. And again, I would urge any country that's considering implementing front-of-pack labelling system to have formal evaluations and reviews just like this. And I will finish there. Thank you.